Introduction. Loss of vision is associated with a number of adverse psychological effects. When identified, these effects can be addressed by nursing interventions. The following paper presents 2 nursing care plans based on nursing diagnoses related to vision loss. First nursing diagnosis. The first nursing diagnosis is powerlessness-hopelessness related to illness-related regimen and unpredictability of the disease. Therefore, a teaching plan pertinent to it will include information regarding the progression of the disease. Specifically, the patient should be informed on the core causes of vision loss, common symptoms accompanying the condition, possible adverse effects, available treatments, and long-term consequences. This aspect of the plan will provide the patient with the necessary understanding of the underlying physiological processes and, by extension, reduce the unpredictability of the disease. Second, it is recommended to explain to Jessica the treatment options prescribed by the clinician. This component of the teaching plan will serve as a justification for the illness-related regimen. Third, it is recommended to provide the patient with time management strategies and tools to ensure adherence to schedule and, more importantly, time allocated for maintaining the desired quality of life. Nursing care plan. Consequently, the nursing care plan should include several components. First, the patient should obtain access to, and sufficient understanding of, necessary treatment options. This step will encourage her participation in the treatment process, empowering the patient to take control of her condition. To further increase the effect, it is recommended to familiarize Jessica with self-monitoring tools and logging techniques, which will improve the quality of the information and ensure patient involvement. It is also important to control the medication administration process, both by administering the medications whenever necessary and by demonstrating effective self-administration techniques. Another important component in informing the patient on the progression of treatment and discussing decisions with the patient. Finally, it is important to assess the effectiveness of self-treatment and the level of patient satisfaction associated with it. Second nursing diagnosis. The second nursing diagnosis is impaired ability to perform or complete activities of daily living related to the vision loss in her left eye, evidenced by visual acuity of 20 and 200 in the left eye. Thus, it is necessary to include in the teaching plan the explanation of requirements to Jessica's immediate environment. For instance, it is important that the patient understands the criteria of safe living and working conditions, such as furniture placement and lighting. Second, the patient should be informed on the daily activities that are likely to be affected as a result of the degraded visual acuity. This aspect of the plan will improve the patient's preparedness for inconveniences and challenges of her condition and prevent unforeseen situations. Third, it is necessary to educate Jessica's family on the challenges posed by her vision loss and measures that should be taken to reduce the impairing effect. As a result, the patient is expected to avoid vision loss-associated injury and, by extension, improve her ability to perform activities of daily living. Nursing care plan. The first component of a nursing care plan pertinent to the diagnosis will involve the assessment of the degree of visual loss. This will provide a nurse with a sufficient understanding of the severity of the patient's condition and guide the treatment process. Next, it is necessary to promote patient independence by identifying potential constraints and barriers encountered on a daily basis and explaining effective ways of overcoming them. Third, Jessica needs to obtain access to local organizations that provide support and counseling for people with vision loss. Finally, psychological and emotional assistance should be included in the care plan to facilitate empowerment and autonomy. Conclusion. As can be seen, the patient is expected to encounter several difficulties in daily activities. As a result, it is also likely for her to feel powerless or hopeless. The provided teaching and nursing care plans are expected to minimize the adverse effects and improve the ability to cope with the condition on a daily basis. You can find this and many other essay samples on our website studycorgi.com.